President Cyril Ramaphosa announcing that South Africa moves to lockdown level 2 from tomorrow. And in a nutshell, the new restrictions because of COVID-19 numbers going up, gatherings have come down from 250 indoors now to 100 indoors. Only 100 people allowed to gather indoors, and outdoors 250 people are allowed to gather. That is down from 500. And of course, the experts have been saying this is where it all happens. Gatherings where people are not following social distancing, not wearing masks, those are the so-called super spreader events. Funerals restricted to 100 people, and no after tears, as they are called, is allowed at all. And then the curfew moving from 11 p.m. to 4 a.m. Right now it's from midnight to 4 a.m., so that has been extended. And then, of course, businesses that are non-essential have to close earlier at 10 o'clock so that their workers can get home. No banning of alcohol, no restrictions on trading hours. Those in the liquor industry will be relieved about that. They've been sounding the alarm bell on illicit trading ahead of this. But right now, according to the experts, hospitals are not under pressure, although it's coming. South Africa, as a nation, is entering the third wave. Already 4 provinces have declared official third waves. We saw earlier that the Northern Cape may even be coming out of its third wave. Let's look at some of the other things that he touched on. A vaccination update, talking about the second phase, some problems with the electronic data system, the EDVS system, but he says that within the next few days, South Africa will see somebody receive the 1,000,000th dose. All right, let's see who we have now. A spokesperson for the DA, Siviwe. Can we get the DA's response? Siviwe Khwarube from the DA, your reaction to the President's address tonight?
To your viewers, we've noticed the President's regarding some of the restrictions that are going to be put in place. However, we are of the view that South Africa in general does not need stricter lockdowns, but South Africans need vaccines. As of Friday, the 28th of May, government would have vaccinated less than 1 million people. And ultimately, this means that vaccinating 40 million people by year end is probably unattainable with the pace that we are going at. And secondly, it was really disappointing, quite frankly, that the President failed to address the massive elephant in the room, which is that the fact that the person who's been charged with leading the response to COVID-19, Minister Zweli Mkhize, has damning allegations leveled against him. But the President failed to even make so much as a comment about what is being done with regards to that and where the SIU investigation is. We are of the view that the minister must step down until the finalization of that SIU report.
Yeah, the President has spoken on it before. I think he said that there should be some space for that SIU to do the investigation. Hopefully it will be quick. So you're saying that's not good enough?
Absolutely not. I mean, what we cannot have is a situation where the minister is both a player and a referee in an investigation that concerns him. Ultimately, he needs to be removed from that post so that the SIU can be able to conclude its investigation without any undue political influence. He needs to step down until the finalization of the SIU investigation. And ultimately, you know, the President's lack of even mentioning any of this for us really demonstrates that his commitment to fighting corruption is just that. It's just simply empty words. And so we are of the view, again, that the only way South Africa can really pull out of this pandemic and the devastating effects of the pandemic is if South Africans are getting vaccinated at pace. The third wave of infections was always inevitable, particularly considering the fact that we haven't even reached 1 million people in the last couple of months. And so the only answer to this is not stricter lockdowns, because we know that this has had devastating effects on the economy, devastating effects on people who have lost jobs, And as a result, we are of the view that government needs to absolutely ramp up its vaccination program as soon as possible.
Ms. Gwarube, please just clarify, are you opposed to these new lockdown restrictions? Because it does seem like government is taking a light approach, focusing on the gatherings. Those are the potential super spreader events, focusing on the curfew. Certainly the gatherings would be in line with what experts are saying. Act on those right now.
Absolutely. Look, I mean, we are not opposed to the restriction of gatherings. As you said, science dictates that the large gatherings are a huge contributor to the spread of the virus. And so there's no way that we could be opposed to this. But what we are saying is that these two things are not mutually exclusive. What you do need is that while you need to act on gatherings and while you need to really enforce that people must mask up, must avoid gatherings, the reality is that you cannot keep people in perpetual lockdown. You've got to be able to ramp up vaccination so that you can free up the economy, get people working, so that you can get people out of being condemned in perpetual poverty. That's the thing. And if government only has one single approach to dealing with this pandemic, which is really just to focus on lockdowns and not necessarily ramping up the vaccination drive, as they've repeatedly committed, then we are in trouble.
All right. Thank you. Dear National Spokesperson Cyril Ramaphosa on the line for us. Joining us now is Wendy Albert, the CEO of the Restaurant Association of South Africa. Ms. Albert, thank you for being with us. Based on our discussions in the past, I presume that you're very relieved that he didn't mention alcohol tonight.
Absolutely. We appreciate government supporting the restaurant industry's integrity, and that they recognise that we certainly have played our part over the last months to ensure that we exercise all levels of safety and put the health and safety levels at the highest possible rate that we can in the industry.
What about the curfew hours? So restaurants have to close at 10 o'clock. Possible impact?
Look, absolutely. We are also concerned about the numbers that are rising. I think the key part here is obviously we need to expedite the rollout of the vaccines. We're grateful that our businesses haven't been rudely interrupted. That causes more economical impact and that more jobs are lost. So the curfew is tricky for us. It does cause operational issues. 10 o'clock to get patrons through our doors by having a dinner time trade does put complexities on it.
Yeah.
But, we are able to trade, and we appreciate the consultation, the collaboration that they've got in keeping our businesses open and appreciating the work that we've done over the months.
What is the picture right now after the first wave, after the second wave, after the crippling lockdowns that hit the restaurant industry severely? Do you have a percentage of businesses that just no longer exist? And what about the looming third wave? Are people terrified?
Absolutely. When the conversations start like this, the industry certainly gets very apprehensive, and people start getting very nervous. Our business owners start getting nervous. And most importantly, the employees get very nervous. We're the industry that has had the hardest take throughout lockdown. We've had to remodel our businesses, and we've really struggled the most out of every single industry. And the conversation that still needs to take place are those conversations with banks. The banks are putting severe pressure on payback, high interest, accumulative interest, which we are not able to pay back at this point in time. We certainly have seen a lot of restaurants struggling with the landlords, a lot of landlords cancelling leases and giving notice to our restaurateurs to find alternative premises, which is lending itself to, again, finding very innovative solutions to the industry and looking at different ways of remodeling their businesses. Insurances are still tricky. We haven't had payouts on some of the insurance companies, TERS, UIF. So there's still a lot of saga and a lot of demands on the industry to try and keep the survival mode open. What we have found is that we certainly are an isolated industry trying to rebuild our industry single-handedly. So, when government recognises the hard work that we've done, we really are appreciative of it, because we are alone without the necessary support in being able to find ways to rebuild the industry.
So you say there's been no mercy at all. I mean, you've been complaining about the landlords, about the banks for a while. So there hasn't been a softening towards the restaurant industry, finally.
Absolutely not. Whilst there was some very short-lived conversations and there was a relatively very small input to show consideration, it wasn't long-lived. And, business in the restaurant sector is a very difficult, very tricky business model as it is. And without continued support to finding ways for us to be able to put proper structure in place to be able to pay back all this debt, restaurants simply can't survive through this difficult time. And they've chosen to close their doors, which means many more people lose their jobs. If we could find a collaborative way with both the banks and the landlords to have a reworkable model. But the landlords also claim that they're also business owners, which puts us into a difficult position. So it is easier for them to cancel leases than to suggested bringing down the rentals and to look at a more long-term relationship with us.
Yeah, difficult for everybody involved. Thank you for that reaction. Wendy Alberts, the CEO of the Restaurants Association of South Africa. Now, the FF Plus leader, Dr. Peter Groenewald, joining us on the line. Dr. Groenewald, your reaction to the President's address?
Good evening. I want to say that it is a more rational approach to the situation in South Africa from the President. Although the Freedom Front Plus can mention that we are, from the government side, too blasé as far as the vaccination program is concerned. The President is saying that we are quite on track. We are very far behind. In fact, the ANC government failed the people of South Africa with all the delays in the start with the vaccination program. We also expected that the President should have had an approach when it comes to indoor gatherings, that the 50% floor space should be the criteria and not limited it only to, say, 100 people. Yeah. You have venues that can have more than 100 people and still comply to all the protocols.
Dr. Groenewald, can I stop you there? Because there is a claim that even if you limit it inside and everybody's wearing a mask and there are seats between the patrons or the churchgoers, it's outside in the parking lot that people gather and mingle over tea, over little gatherings outside. What's your response?
Well, if you say it's outside, of course, then it is 250 people. I think
I'm saying that the problem with the indoor gatherings is that people all move outside to the parking lots and mingle together.
No, but I mean, if you say parking lots, I mean, if you go to shopping centers, you will have more people like that, if that is your argument. I specifically refer to indoor gatherings. Now you say, well, when they leave the indoor gatherings, then, for instance, they're going to mingle in the parking lots. Well, then we have a problem with all the shopping centers, because I am sure that many more than 100 people are mingling in the parking lots as far as that is concerned. Can I also say that I think that the President should have mentioned the whole issue about digital vibes from the Minister for Health. I know he said that he's waiting for a report from the SIU, but it is quite interesting that the South African Communications Association said today that from the start of the whole pandemic that they offered their free services for the government to communicate with the people of South Africa. And we as people and taxpayers of South Africa expected the President to just mention and apologize for all the corruption taking place in South Africa.
All right, thank you for your response. Leader of the FF Plus, Peter Groenewald, on the line now. We have Bishop Malusi Mpulwana, the General Secretary of the South African Council of Churches. Bishop, I guess the main thing that affects churches is the gatherings, the number of people allowed. Your response to that?
Well, first of all, I think we should acknowledge something about how the churches during the most important season of Easter contained themselves in the restrictions that were given of 250 indoors and 500 outside. And that the fact that throughout that time there was no super spreader experience from the churches or all religious organizations, including the period of Ramadan that we've come out of. We believe that it is a mistake to combine the religious gatherings with all other gatherings, because religious gatherings serve a different purpose. They serve a purpose of dealing with the psychological challenges that people have as a result of the COVID experience, the deaths that people are experiencing, the loss of livelihoods and so on. which no other gathering deals with. And so we think that the categorization of gatherings as all in the same way is not helpful. So the religious ones, regularly churches, will have a problem with that. But we do appreciate that the increase in the infections is so bad. In fact, at the SABC, at least for that constituency of the churches, we are already been working very hard on measures to try and use our congregations not only to curb the spread of the virus, but also to propagate the better measures in our communities of mask, of distancing, of sanitation, as well as ventilation. So those are things that we're already doing, and we're committed to that. But we think that the categorization of religious gatherings with all gatherings that are super spreaders is not a helpful one. I think the most important thing is to try and make communities, and we're trying to do this, that these social gatherings that people are having must be managed.
All right, but there have been super spreader events in the past, way back. You're right, I think it was even before Easter. But I'm thinking of the Free State where Kenneth Mshwe was infected and a whole lot of people were infected at that church gathering.
That was over a year ago, in March last year, before anybody knew how to manage this. And since then, the churches have not done that, man. And so it really is about saying, how do we get to families, communities, neighborhoods to stop these parties those are really where the problem is. And I think that, look, we can't change the government. They've done what they've done now, but we think that it is counterproductive to prevent the space where people's problems and woes are being managed by the worship communities.
All right, Bishop, so you are disappointed with that limit in numbers. I think we've spoken before about churches doing things differently, using Zoom calls, streaming online, but I guess that still can't reach many South Africans.
That is the elitist way of worshiping. Most communities are not able to use that. They don't even have the data to participate. But I mean, the key thing is that the churches are actually allies in a way, because they have got the congregations that can take the messages that are necessary throughout their communities, including the promotion of vaccination. Can you believe it? We went to Tembisa for our vaccination, and in Tembisa, we got 5 million people that need to be vaccinated over the age of 60 today. But you know what? Only 2,000 people had been registered, we were told, in that Ekurhuleni area, which means that you need a greater propagation of promoting vaccination registration. For that, you need the churches to be functional.
And you say the churches are doing that because, Bishop, the misinformation around vaccines, I think, is going wild. The president stood up tonight and said it's safe, but so many people don't believe that, despite what the science says. So can the churches make a real difference there?
All the more reason you need them to gather to do that, because they are doing that. We are out there in a campaign to make sure that we save lives. It is reported, I think the president would have said this, more than 60% of the people that die from COVID are above the age of 60. These 36% of these people fill up your hospitals. We need to make sure that the elderly are registered. They are, in fact, all of us as volunteers, every day I need to make sure that I've reached 10 people who have not registered and make sure that they're registered. And we're asking everybody to do the same. But you need to have the spaces that are organized, that are structured. And that's what faith communities are doing. The Muslims, the Hindus, the Jews, every one of us are committed to do this on an interfaith basis.
All right, thank you very much, Bishop Malusi Mpulwana, the General Secretary of the South African Council of Churches. Let's now speak to Ngama Nchona, ATM National Communications Manager. Ms. Nchona, can you give us your response to what you heard from the President tonight?
Thank you so much. Good evening to you and good evening to the listeners. I have to say that we are disappointed. It is becoming apparent now that these lockdown regulations and the tightening of lockdowns by the government seems to give off or fend off as a dictatorship of some sort, and specifically limiting the space for those who are anti the sixth or the current administration. There is something that always happens where you see some coincidence that the lockdown will always coincide with mass gatherings of people who do not really subscribe to the values, or people who have looked at the current administration and looked at it in a manner. They are very critical, to be exact.
Can you give us examples, Mr. Nchona? What would government's ulterior motive be right now? What would they be trying to suppress?
One, take a party like the African Transformation Movement that is faith-based, values-driven, and a self-funding party. I'll just focus on the first part, the faith-based.
No. Can I ask you not to tell me about the party? But you said that government would try and suppress mass gatherings. Have you held a mass gathering recently, Mr. Nchona?
We have heard gatherings within the regulations. Yeah. But with these particular, this tightening that is going to happen right now, it's going to limit the space of us being able to do so. But most importantly, because I want to focus on the first part, which is the faith-based. Faith institutions have been pivotal in giving space for the downtrodden so that they are able to get a support system even in this time such as this. You'll remember that this is one of those times where people are losing people by the numbers. So when you take away this particular support that is closest to the people, when people are not able to access, because they do not have money, some kind of comfort in psychologists, some kind of comfort in other ways that could assist them deal with the problem.
Right.
So this is why we are saying it is unfortunate that when we look at this, we're beginning to see that the government is kind of using this to micromanage and control as a control mechanism. And it raises an eyebrow and a question of what would be the relationship of this micromanagement in a year of the elections.
All right.
That is number one.
All right,
and number
thank you.
two.
So we have to cut it off there. I think you've got your point across that this is being used by government to restrict gatherings which could challenge the government in effect. Thank you very much, Zaman Shona from the ATM. We do now have on the line Maurice Smithers, Director at the Southern African Alcohol Policy Alliance in South Africa. Again, I'm sure great relief because alcohol was not mentioned.
No, absolutely no. I think, Francis, you misunderstand our position. We are a social justice organization concerned about alcohol-related harm, and we, in fact, believe that there should have been more restrictions on alcohol. The president mentioned in his speech that one of the key places in which the virus is spread is in gatherings. And our argument all along has been that alcohol-induced gatherings are even more risky because once people have had 2 or 3 drinks, they're very unlikely to observe the COVID-19 protocols. They won't wear masks. We've seen it in videos and so on that have circulated. They won't wear masks. They won't social distance. And so the risk of the virus spreading is much greater.
Yeah. He spoke about fatigue, though. I mean, that happens anyway. Some people are just tired of wearing the masks. It doesn't matter if they're drinking or not.
This is true, but nevertheless, I mean, the point that he was making is that we have to overcome the fatigue, because if we don't, then the virus is going to spread more. We are going to see unnecessary deaths. The hospitals are going to be overcrowded. So we believe, actually, he could have gone further. We had called for an extension of the curfew. We didn't go far enough. We said 10 o'clock, he said 11. And we also called for gatherings to be more limited. We said 50 indoors, 100 outdoors. He hasn't gone that far. But we do believe that more needs to be done to focus on the issue of alcohol, because there's no doubt that alcohol has been one of the major contributors to the spread of the virus. We just had to remember last year with the matric rage in Ballito Bay, where 1,000 students got infected, and there were major infections in the Eastern Cape where people were attending huge alcohol-fueled gatherings.
Mr. Smithers, though, if he had restricted alcohol sales now, look, the infections are going up, but if you look at the hospitalization rate, I think it's around 3,000 per day. We spoke to somebody earlier monitoring the situation, saying the hospitals aren't under huge pressure yet. So in this situation, wouldn't it have seemed very draconian to cut or curb alcohol sales or ban alcohol or anything like that? And I guess guess you can address the suspicion among some people that this is a health excuse. We talk about health, we talk about hospitals, but some people believe that government, when it restricts alcohol, is trying to use health as an excuse to restrict people's choices, because alcohol is legal in this country.
But for what reason, other than health, would government want to do that? I can't really understand the thinking behind that argument. Government's only reason, not just in South Africa, but anywhere in the world, for having restrictions on alcohol is health-based. It's not, unless you live in an Islamic country, where it's religion-based, it's all health-based. But the point we're making is that, you see, I think one of the challenges is that right at the very beginning, when there was the ban on alcohol, the whole argument was focused on the hospital beds. We believe actually the dynamic has shifted, and it's much more about the spreading of the virus. So we've been very clear, we don't want a ban on alcohol. We think that it's not productive. We think that it causes too much hostility. We think also it has a very, very dangerous and dramatic economic impact. But nevertheless, we have to take account of the fact that when people drink in groups, in social gatherings, they don't observe the protocols.
All right.
And if our aim is to prevent the spread of the virus and to curb unnecessary deaths, that's what we've got to do. And we're hoping, anyway, at least, that government between now and the fully fledged third wave will continue to monitor the situation and incrementally increase restrictions without having to go to a full ban like we had to do in December last year.
All right, thank you. Maurice Smithers, Director at the Southern African Alcohol Policy Alliance in South Africa. All right, let's speak to Nkuleko Hlengwa from the IFP joining us now. Mr. Hlengwa, thank you for being with us. What is your response?
Good evening, Francis, and to the viewers. Whilst we welcome what the President has said tonight, you can't really close the door once the horses have bolted. And there seems to be a laissez-faire approach on the part of government to respond with the necessary speed and urgency to the very critical and dire state which South Africa is in currently. The issue of the third wave has been long in the making, and the warning signs have been there. And therefore, to respond to it when it's actually happening is what we find most concerning. And it borders on reckless and irresponsible behavior on the part of government.
Yeah. So you would have wanted more restrictions in place already?
Should have been done much earlier, because you need to juxtapose it against the very slow pace of the vaccination program currently at play in the country. So you, on one hand, you are not taking the necessary steps to slow and flatten the curve early, but also your vaccination program is moving very, very slowly. So those two things combined are a recipe for disaster. Two, there's no clarity insofar as the scenario planning that government is engaged in for all the future activities that will take place, particularly elections. The President was absolutely silent on that. And it's important and crucial that we actually determine how the election campaigning is going to take place, given the fact that it was the President who actually gave an announcement of the date. The Montenegro Commission is the knee-jerk reaction to issues which should have been considered before the announcement has been made. And so we fundamentally believe that the government is sort of blue-ticking the challenges which the country is faced with right now and responding much slower than what we would have expected. And we are calling for heightened urgency on the part of government, given the challenges that the country is faced with.
On the elections, is not the wait-and-see approach the right one? We spoke to a health expert earlier looking at the Northern Cape, and the figures suggest that the numbers are going down there. It may have already peaked, gone through its third wave. So we have no idea what the picture will be in October.
Well, then that's fundamentally the problem. It speaks to a government which does not have adequate and sufficient necessary knowledge, skills and expertise for the kind of scenario planning which you require, given the fact that elections are not an event, they are a process. You've got political parties who have to nominate candidates, and that means gatherings. Then you've got door-to-door campaigns and all sorts of other things before you actually arrive on voting day. So this is something that must be taken with seriousness, because it's going to be a reality of the political landscape of the country in between now and October. And the absence of the necessary guidelines and protocols to assist in the process is what was of concern to us. And coupled with that, of course, is precisely what you're saying, that the vaccination program is not moving with the necessary speed, even by the president's own admission. And then, of course, the fact that the third wave had long been predicted, and the president lost it to the country 2 months ago, is in itself something which tells us that government is possibly now sleeping on the wheel.
All right, Kuleko Lengwa, a spokesperson for the IFP. That some of the reactions, political, from different organizations, depending where they stand in terms of alcohol sales, will bring you more after this short break.